Hello and welcome. On this episode of Therapists Together, we're going to take a slightly different tack. We're going to be talking to one of our fellow therapists, Suki Carpenter. She's based in London. And Suki has been going through some issues. We've treated her a little bit in the past. We've done some client intake, and we're just really doing a follow-up, kind of like a telehealth session now, where we're going to discuss the current situation, that the symptoms and things that Suki is suffering from, and see if we can guide her through a little bit of treatment. She's a qualified therapist herself, so she's going to have a good idea of this. I would always say that there is more than one way to treat any condition. One of my favorite sayings, I think it was Serge Krakovetsky, said, if you get three therapists together to discuss a treatment scenario, the only thing you'll get two of them to agree on is that the third guy is doing it wrong. So bear in mind, there are many different ways of doing this. We're not suggesting this is the only way to treat. You probably have many other techniques that you use and they can certainly be implemented, but you can also try adding some of these techniques into your self-treatment or maybe treatment that you're recommending with clients once you've practiced this yourself. So with that, I'd like to say, welcome Suki, how are we doing?
Hi, thanks for having me.
So Suki, we did a little bit of work before and the symptoms you were experiencing were mostly in your hand and wrist. Can you tell us a little bit about what you're currently experiencing?
So it's still in my hand and wrist, but it's sort of elusive because then it goes to my elbow and then it goes to my bicep and sometimes my deltoid. So I've been doing a lot of self massage, but I don't know what else is happening. So I've come to you to to get some advice.
Hopefully we can help with that. So one of the things that I think is a key indicator, when we initially were doing assessments, we were checking the musculature, the joints and the ligaments around the forearm and into the wrist and hand. And like Suki's explaining about how the symptoms seem a little bit elusive, the tests were inconclusive. We were just doing active, passive and resisted tests. And they were kind of inconclusive. The symptoms would shift, sometimes it would test positive, sometimes not. And from a clinical reasoning standpoint, that's actually a pretty good indicator that the problem is neurological and that it's coming from somewhere else. Now, neurological could be a couple of different things. It could be neuromuscular trigger points referring pain. It could be ligamentous referral pain, or it could be simply nerve irritation, what we'd call a multiple crush phenomenon. And what we found when we treated Suki's wrist and forearm, that being a therapist, obviously there was some muscle tightness and things like that that did benefit from direct treatment, but it didn't really seem to alleviate symptoms until we had really traced our way back along the path of the nerve and began to work the scalenes in the neck. Another indicator, apart from the fact that the assessments were non-specific, is the symptoms that Suki's saying that it's moving around. Because if the symptoms were constantly in the same place, let's say if I had torn at the muscle tendon junction or something, every time that area became irritated, it would be very localized. It would also be easy to detect because when I press on the injured structure, that would elicit a pain response. Whereas, Suki, I think you're not really getting those kind of things.
No.
Okay, it's very non-specific.
Yeah.
And this is what confuses. And I find even therapists themselves will oftentimes be very clear when they're treating somebody else, but in some ways it's more difficult when you're trying to treat yourself. Things that you might see with other people, you maybe aren't as aware of in yourself. We don't relate to it in the same way as treating somebody else. Suki, I think we found last time when we treated you that it seemed like a lot was in the neck. So I'm just going to have a quick look at the neck. Can you sit up kind of nice and straight? Maybe just get your hair back off your neck so we can see the natural position of the neck, just sitting normally. Because one of the things I've noticed is that although symptoms might be one-sided, like you're typically saying your symptoms are on the right
Right. Yeah.
side. And when we look at your posture, it appears to me like the neck might actually be a little bit tighter on the left. So an important point here is that the symptomatic side is not always the causative side. So we're going to treat both sides of the neck, even though most of the irritation that Suki is experiencing is going to be on the right arm. And really what I'd like to have a quick look at, I'm going to do a quick screen share here because it's good to get an idea of the anatomy involved. We have what's known as the scalene triangle. And the scalene triangle is made up by the first rib, the anterior scalene, and the middle scalene. So we basically have the first rib here, the border of the anterior scalene, and then the middle scalene. And then coming out between them are these structures here. This is really the whole nerve supply to the arm. So we have these different nerves. This is coming out of the scalene triangle, and this is basically the brachial plexus. So the reason I wanted to show this is partly so that we're familiar with the anatomy in the area, but also because this would typically be referred to as an endangerment site. Now, an endangerment site doesn't mean it's somewhere that you can't work. It just means that somewhere that you have to work with caution. So what we're going to do is I'm going to do a little bit of warm up before we get into this area here. But when we do go to work this endangerment site, we're going to be very careful that you're not getting increased neurological symptoms or sensations. So the first thing we're going to do is just try a little bit of gentle loosening on the top layer, really between the skin and the superficial fascia. So what I'm intending to do is just drag the skin a little bit and create some movement. I'm not pressing in very strongly. It might look like it because I'm using my whole hand, but it's not a very strong contact. So I'm going to just hold the skin and I'm going to turn the skin in one direction. So here I'm actually kind of twisting the skin to the right, if that makes sense. I'm twisting the skin to the right and I'm turning my head to the left. And this is super gentle. You may even be able to see this on the skin. If I twist the skin and I turn my head, when I let go, the skin kind of recoils. So I'm really just using the elasticity of the skin. So turning the skin in one direction and turning your head in the opposite. And we can work our way around towards the back of the neck. How's that feeling, Suki?
Okay, I've got it that way.
Yeah. Now remember, the contact is really gentle. It can be broad. You can use your palms and your fingers or just the lengths of your fingers. So the contact area, really bigger is probably better because you're affecting more surface area, but it's not very strong. It's really gentle contact that I'm just moving the skin and then moving the structures underneath it just to create that little bit of separation. Till Luca talks about this a lot, where he says that there's a huge amount of nerves in this area directly underneath the skin. And where a lot of what we do as body workers is affecting the nervous system, it's really good to address these nerves. Okay, you happy with that one?
Yeah.
So let's just get you doing that again and just see how we're getting on. So you're going to turn the tissue one way. Good, nice and gentle. Perfect. How's that feeling?
Really nice.
Good. The way they describe this is think of it as like a sleeve around the neck. And that's really what you're trying to turn, like you're trying to turn a scarf rather than actually get into any kind of deep muscles. Yeah. Okay. So the next layer we're going to work is platysma. It's the layer of muscle just underneath that. And what we're going to do here is you're going to go almost towards the collarbone. You're going to pull down, and really I'm just lapping down off the collarbone, kind of where platysma is attaching. I'm going to hold the tissue, I'm going to restrain it, and then you can try a couple of different movements. You're basically going to pull away from the restraining hand. That's good. You can do that with me. Good. Okay. And you can even try adding a few other movements. So once you pin the tissue, lean back and away, and even turning the head.
Oh yeah.
Feeling that more?
Yeah. Right. Yeah. It's I think it's my sternocleidomastoid I can feel.
Sometimes the platysma, because it's sitting on top of sternocleido, the two of those can get a little bit stuck, particularly if we're not doing enough variety of movement. Variety of movement is really important for tissue and even for our neurology as well. Let's try that on the other side just for balance. So pinning down, leaning away, turning the head, seeing which positions give you the greatest feeling of ease and release. Where's the restrictions? How can you work through those?
Ease that way, restriction looking right.
Okay.
So
work into the restriction. Okay. It's a nice simple one, isn't it? But yet quite strong. Yeah, quite strong. And this is still kind of top layer because this is one of the principles I think to really successful body work is to deal with all of the different dysfunctions in each layer, however major or minor they may be, that you're working from the superficial down to the deeper tissues and hopefully addressing each dysfunction as you go, rather than just diving into the problem. Okay, sternocleido, big prominent muscle in the front of the neck. A lot of people have different techniques for working this. I like to do a nice simple one where you're just going to hook away. So I'm not pressing into my neck. I generally wouldn't do this with clients. I would do it on them, but I wouldn't do it in a telehealth session like this. But with a therapist, we should be able to feel the edge of sternocleido, and you're literally just going to bend sternocleido by pulling it out from the neck. You're not pushing into any of the endangerment sites, any of the delicate structures. So you hook and just turn the head. And again, it's very intuitive. You play around with what angles seem to give you a good release. That's looking good. You feel that, Suki, how you're pulling out from the neck rather than pushing into the neck? Yeah, perfect. Good. You want to try that on the other side?
Yeah. Okay.
Very nice. Good. So again, you're literally just hooking the muscle. And again, you can try different motions. You can try nodding the head, rotating, flex and extend, more kind of like neck on torso movement rather than just head on neck. Any of those kind of motions that you feel is really getting into sternocleido for you. Okay, so now we get to the main event. We're getting into the scalenes, particularly the anterior and middle scalenes, because those are the ones that the brachial plexus is coming out between, those nerve roots are coming through. Here we're going to go just behind the collarbone. And word of caution before we do this, because naturally you're about to reach, that we are in an endangerment site. And the particular structures that we're cautious about here is nerves and blood vessels. So here's how you know you're going too strong or pressing on a delicate structure. If you press on a nerve, you will get a shooting, burning sensation, very kind of nervy type sensation, almost like hitting your funny bone. You'll feel that. And if you do, move off. You shouldn't irritate the nerves at all. If it's a blood vessel, it's going to be the artery. It's going to be your brachial artery. What you'll find is that you'll feel this rhythmic arterial pulse. If you feel a pulse, you got to move. Don't compromise the artery. So with 2 fingers just coming over the collarbone and into that little indentation behind the collarbone, you're staying very close to the neck. Let me do this on skin maybe so we can see a bit better. Okay, so I'm behind my collarbone and I'm just getting into the base of the neck there. That's good. Okay. Now initially what we want to do, because these tend to be quite sensitive, is we're going to bend towards the side we're treating. So I'm bringing my ear towards my shoulder, but I'm also coming forward. I'm doing everything I can to really shorten my anterior scalene. And now I'm doing a gentle pump. Now I always say with the pump, it's more like an undulation. It's not CPR, okay? Not sharp, not harsh. You're just gently pumping those tissues. Settling down the nervous system. There's arguments for and against. Some people will say you're hydrating the tissues. Some people will say there's not that much hydration taking place. But either way, after about 10 or 15 seconds, what you'll start to notice is a reduction in sensitivity and usually a softening of the tissue. You feeling any change in that, Suki?
Yeah.
Getting a little easier?
Yeah.
Okay.
Yeah.
So now what we're going to do is hold, and I want you to turn just as far as is comfortable. When it starts to get sharp, turn back. Pump again. That's good. So you're leaning in towards it to soften the muscle, to get it to relax. Pump the tissue. And now hold it, so you're pinning the tissue, and turn the head away. Turn to the opposite side, so you're turning left. That's good. As far as it's comfortable. You see that gets sharp at a certain point? Turn back towards the side you're working, and pump again. Usually about 3 goes of this is enough. Sometimes you might need to do more. You might need to do 4 or 5, but 3 is usually pretty sufficient. Turn again. Good. And now you can even change position. You can work a little further back. Still staying close to the neck. Being aware of, do you feel an arterial pulse? Move if you feel a pulse. Now we're getting more kind of middle scalene. Okay, just checking in, make sure you're not feeling any odd sensations or tingling down the arm or anything, Suki?
No, it's fine.
No, good. And we want to make sure there's no worsening symptoms or anything like that, that we're not irritating the nerve. Good. No arterial pulse? Okay, good. That's looking good. So once you feel a change in the tissue, again, after usually 10 to 15 seconds, we can start to turn away. And again, you can add variety of motions. You can start to side bend. I think rotation is probably a little bit easier to tolerate. But maybe if you're practicing this over the course of 5 or 6 days, you might get to the point where you go, oh, that's actually pretty easy. I can turn without any discomfort. Now you could maybe start to up the game by increasing the intensity with a little bit of side bending. So that's an adaptation that we can make as we go along. You happy with that one?
Yes.
Okay. So next we're going to look at a quick technique for pec minor. So we might even start off with just some pec minor stretching. Let's see how we get on with that. Good.
Yeah.
So getting nervy?
Yeah.
Okay. Another good indicator. So what I would say is avoid that one for the moment. We'll add it back in later, but we don't want to be doing anything that's going to irritate already irritated nerves. The scalene one, once the pressure comes off the nerves here, this area will be less sensitive. So that might be something we'll leave for a little further down the road. Okay, so next we're going to work down into bicep. And here we're going to do a really simple one where, like with the tissue of the neck, I'm going to twist the bicep in one direction. So in this case, I'm twisting out. I'm going to twist the bicep and I'm going to turn the arm in. That's it. So I push out with the tissue, twist the arm in. I'm just going to try this from a couple of different angles so that we can see what I'm doing. You can do it from whatever angle is comfortable. That's good. And then we're going to go the opposite way. So I'm going to pull the tissue in and twist the arm out. That's good. Pull the tissue in. So although this is the opposite, the principle is the same. We're basically pulling the soft tissue in one direction as the bone moves in the opposite direction. So what we should be getting is shearing force between the top layer and the deepest layer, the bone. And a lot of people will say that that's going to create a myofascial release. Other people that argue against that, we would say, well, it is creating novel nervous system input. So it's at least bringing new information to the nervous system and helping it to desensitize because it's being interested in what's happening here, that it's not its normal sensation. Okay, so that's kind of going across the muscle direction. We can also do longitudinal work. So you can bend the elbow, pull the bicep away from the elbow, and then straighten the arm. Now again, this is done gently and slowly. If you go too hard or you go too quick, it may be painful. So the things that are going to influence the intensity is the area, the angle, the velocity, and the pressure. So it's not very strong. I'm not coming in at a very sharp or steep or acute angle. I'm using quite a broad surface area. I'm not using my fingertips or even my finger pads. I'm using more the lengths of my fingers. That's looking good. Good, and you can use your thumb actually to counter force. That's good, or keep it out, whichever you prefer. Some people have a preference for using the thumb. Some people find it easier not to. Go with what works for you, what gives you a good hold on the muscle as you lengthen. Okay. Because this is another area where the nerve is going to be sensitized. Well, where one of the three nerves are going to be sensitized, coming through this kind of bicipital aponeurosis. Good. And then the last thing is kind of self-treatment down into the forearm. So ideally I'd do this on a table, but you might not be able to see it. So I'm going to hook with one arm as I work down the other. And you can add a little bit by just wiggling your fingers. This is what we'd call like a therapeutic addition. Let me change my position and see if you can see this. So I hook and wiggle. So you see the way I'm engaging the musculature, the flexors here with one arm, as I wiggle the fingers with the other. Okay. And you can do the opposite then up along the extensors. But what I'd like to do for a moment is just, because I think last time when we were testing, you were saying you were feeling something on the back surface of the hand as well, weren't you?
Yeah. Oh, yeah.
Still getting that?
And here.
And there. Okay. So good indication that this is the radial nerve. So what we're going to do here is I'm going to use the palm here to grip the skin on the back of my hand. So watch how my fingers move when I grip. That when I pull, the fingers nearly pull up. So I hook and then curl my fingers. You can actually see the change in coloration of the skin, this kind of blanching. It's pretty sharp, isn't it? It's a strong one. So again, pace is going to determine intensity. You do want a reasonably strong hook on the tissues, but if it's painful, slow down. At the point at which it starts to get intense, maybe just wiggle. Small movements. How's that?
Not as sharp.
Good, good. Because that's what we want. We don't want it to be an unpleasant experience, that we're trying to calm the nervous system down. So we do want to create positive change, but we don't want to alarm or really irritate the nervous system. We don't want it kicking into sympathetic response. We want to keep things nice and relaxed. So always just playing around at the edge of intensity. Intensity is not a bad thing. Discomfort even is not a bad thing. Pain, not so much. Pain isn't going to be useful. So going up to the edge of discomfort, I'd usually describe this as a 4 out of 10. Another way of describing it is that you don't feel like you need to tense up or grimace or guard. Okay. So there is a range of stretches as well. I'm again going to just briefly do a screen share because we have these on our college YouTube account. Yeah, so we have a series of stretches. We have stretches for avoiding ARM or SI, which stands for repetitive strain injuries. This is the kind of thing that would be quite useful for you. I don't know how well this is going to play, but it shows some of the anatomy, and it also then shows you how to do different stretches. Here's a variation on the pec stretch. So this is available on our college YouTube channel. So if you just literally go on YouTube, type in Holistic College Dublin, you'll see that. There's a long and a short version. So the longer version is more for therapists. It's about 16 minutes long. The short version is the one we tend to refer clients to. It's about, almost 8 minutes. So those can be quite useful for a routine that's literally stretching all of the tissues from the neck all the way down to where you're likely to be symptomatic. So it'll include stretches for the flexors, stretches for the biceps, stretches for pecs, stretches for scalenes, stretches for sternocleido. So a lot of those are there, and you can do those as part of your home care. Let me see now. So the other thing we were going to look at was, it's going to be a difficult one to show you because I'm going to have to stand up. The simplest way to describe this is they say it's like the old waiter's tip. So I'm going to reach back. What I want to do really is kind of put my thumb just inside my fingers a little bit, and I'm going to do this kind of motion. Don't know if you can hear me because I'm getting too far away from the microphone.
Hear you. Yeah.
So I'm doing this. Then I'm coming out from my body and back. So it's almost like a 45-degree angle that you want to go out from your body and back as you poke your fingers out, that you're doing that waiter looking subtly for his tip. Is that one quite sensitive, or how's it feeling?
It's not sharp, but it feels like bruising.
Bruising. Okay, so it's a little bit, there is some sensitivity there. So this is radial nerve, and this is the one that I thought you were likely to need, given the kind of distribution, the area that you're feeling the nervy symptoms into. So it's going to be difficult to remember all that. So we will send you the video, and this is something that I recommend that you can do for clients, particularly if these sessions are quite short, if they're maybe 10 or 15 minutes, that you can always share the video file to your clients so they can watch it back. Or what therapists oftentimes will find quite useful is maybe just even on your phone, if you're not terribly tech savvy, you might find that you just record a quick video on your phone and you can then WhatsApp it to your client, or there's loads of different file sharing mediums, but you can send them maybe just a 2 or 3 minute stretching or nerve flossing routine. That can be quite helpful, that they can try and do their home care as accurately as possible, because there's a lot to remember in all that. Okay, so how are we feeling after that, Suki?
Well, I do feel looser on this side compared to this side now. So I'll probably have to repeat it all.
So that's the thing. You're actually going to go through the same routine on the non-symptomatic side. Now, if you feel absolutely nothing, let's say if you're doing the Platysma one and there's no restriction, you can move on. But I would try it out each day, because you might find some days it's a little bit more sensitive, some days less. And, you know, respond to how things are changing. That if something feels really free and really good on that particular day, you don't need to spend, you know, even 30, 40 seconds or a minute working on it. Move on. It's good. You can go to the next layer.
Okay.
Okay, so you're happy with that? Do you have any questions before we wrap up?
No. Just don't go prodding into things. Just sort of work the sheaths of the tissues rather than going in there. Okay.
And that's a key thing to remember, and I would always emphasize that if in doubt, leave it out. If something doesn't feel good, don't do it. If you're not sure how you're supposed to be doing it and you think you might be doing it wrong, don't do it. Check in again with your therapist. That's probably going to be the best advice. And of course, if there is any more severe underlying symptoms, here, as I said, we've screened and we've tested and we've treated Suki already. If in doubt, refer out. So you may well refer the person to their doctor, because if they're getting neurological symptoms, it could be something else. It could be something that requires an MRI. It could be something to do with disc pathology in the neck, or a whole variety of things. Because we don't know, we need to know. That's why you refer out. So thanks for joining us today, Suki. I hope you found that helpful. And as I said, we'll share this video with you, but we'll be sharing this particular one more widely as well, with your permission. So thanks again for participating, and we'll talk to you again soon.
Thank you.
You're very welcome, Suki. Talk to you. Take care. Bye-bye.